Alcohol use is responsible for nearly 5,000 deaths per year among young people under the age of 21. Alcohol use by underage drinkers results in $3.7 billion a year in medical care costs due to traffic crashes, violent crimes, suicide attempts, and other related health problems. Alcohol is the drug most frequently used by 12 to 17-year-olds and the one that causes the most negative health consequences. The 2011 Youth Risk Behavior Survey conducted by the CDC found that among high school students, 39% of youth drank some amount of alcohol in the prior 30 days. Alcohol can take our youth down a lonely road of self-destruction. Additional consequences of underage drinking include school problems, such as higher absence rates and poor or failing grades. Social problems, such as fighting and lack of participation in healthy youth activities. Legal problems, such as arrests for underage drinking or assault. Unwanted, unplanned, and unprotected sex. Disruption of normal growth and sexual development. Higher risk for suicide and homicide. "60% of the youth surveyed said they obtained the alcohol that they consumed from their home or the home of a friend, with or without their parents' knowledge." The other 40% received alcohol from a friend or stranger who purchased it for them illegally. I'm standing at a gas station in southwest Durham, and within my eyesight there are 5 places that I could purchase beer or wine if I was of legal age or had someone to buy it for me.
Yeah.
States and cities often place a legal limit on the number of alcohol establishments in a neighborhood, town, or city as a strategy to reduce alcohol consumption and alcohol-related problems among the general population. Recent studies show how higher density of alcohol outlets is related to increased rates of homicides and assaults, and it's also associated with a greater prevalence of driving and drinking. In Durham, North Carolina, there is a community group working hard to decrease youth exposure to alcohol. Together for Resilient Youth, or Durham TRI, is a community coalition whose mission is to prevent substance abuse among youth and adults by reducing community risk factors through advocacy, education, policy change, mobilization, and action. Hi, we're here with Wanda Boone, and she's one of the co-founders of Durham Together for Resilient Youth, otherwise known as TRI. And tell us a little bit about the Durham TRI Coalition history and some of the activities you're working on, Wanda.
Sure, thanks so much. And Together for Resilient Youth was founded in 2003, and we actually had our first meeting in 2005. The reason that we came together, or rather my husband and I founded the organization, was because we read a Durham gang report that was written by Buddy Howell. And that report indicated that there was a lot of drug activity in Durham public schools. Well, prior to seeing that, we were therapeutic foster parents, and for several years had children in and out of our homes, and they were what you would expect to see, with just some minor behavior problems. And then as we approached 2003, we noticed that there were more children that were abusing drugs during that time. So we were getting a different type of child, as far as our therapeutic parenting was concerned, and most of the children were also drug involved. So we combined those two things together and figured that we needed to do something about what was an up-and-coming drug problem in Durham.
Great. So what influence has Durham Tri had on any legislative policies in the area?
We're really, really, really excited about the policy changes, not only in Durham, but also at the state level. One of the things we realized rather quickly was that programs, excellent programs, that talk to children one-on-one or in groups about changing their behaviors or about substance abuse were effective. And so we never wanted to reinvent the wheel, but we noted that every year the numbers of people that were addicted to drugs kept increasing. For example, in 2007, 12,000 people in Durham were addicted to drugs. And then just last year, 20,000 people were addicted to drugs. So if we're to make any headway whatsoever, it can't be by just talking to one person at a time. So what were some of the things that we could do policy-wise that would make a difference? Well, what we noticed was that Durham never denied a permit for those who wanted to sell alcohol. And it's not that we're prohibitionists. We believe that adults should be able to consume alcohol. But we also noticed that stores were selling to minors almost 60% of the time in 2007. And so we figured that that's where we really need to try to make a difference. So how do we impact the Durham City government or even the North Carolina Alcohol Beverage Commission in not granting permits if there was a reason not to, such as alcohol outlet density?
Great. In North Carolina, the state exercises primary control over alcohol retail outlets. Local governments play only an advisory role in the state permitting process. The city of Wilmington, North Carolina, however, has recently adopted a systematic process for reviewing applications for new permits and renewals, and they provide recommendations to the ABC Commission. It has also reserved the right to deny renewals on its own authority. Wilmington is interested in decreasing alcohol outlet density in the downtown area, along with the associated crime, public health and safety issues that go along with high alcohol density areas. Durham Tri-Coalition is currently working with City Council on alcohol density issues. The coalition is asking the Council to set up a similar process as Wilmington, and to carefully review all applications for alcohol permit renewals while making recommendations for denial if there is a good cause. In the meantime, Tri developed a Good Neighbor Pledge which asks businesses that sell alcohol to adhere to state law regarding alcohol sales to minors and to provide a safe environment for the community. All of us can play a part in reducing youth exposure to alcohol. See how you can join others in making Durham a safer and healthier place to live by visiting www.durhamtri.org.